Well, as promised before the break, a visit now from PEI's new health minister, everything old, new again, Doug Curry, back in the seat, and welcome back to Compass.
It's good to be here, Bruce.
When I called you today asking for this interview, I thought we'd talk in generalities, but there is all of a sudden a specific to get your voice on, that being the closure of the Surrey walk-in clinic. What's going on? What's the very latest?
Well, you know, the reality right now in Surrey, it's a temporary interruption in services. It's an issue that is facing rural communities all across the country, and that's the ability to provide and retain physician services. And interesting, because 4 years ago, the day after I was sworn in as minister, I was dealing with the exact same situation. And we've had successes in Surrey, and in respect to the complement, we've been floating with 4 plus a nurse practitioner. And as of today, we're up against it again. So we're looking at short-term solutions to manage, and obviously with the long-term investments to hopefully attract physicians that want to work in rural areas of Prince Edward Island.
You chose to use the word temporary. That's an ambiguous word. Is this a long or a short temporary?
This is, you know, well, the hope is it's a very, very short temporary, and right now we're working at short-term strategies around locums to deal with the immediate, but most importantly, we're looking at long-term interventions through the Retention and Recruitment Secretariat to once again stabilize services in the Surrey area.
Robert Giz sat in that chair last night and said that you were the fit for this because this is the toughest of all the portfolios. Why did you want this again? It's so tough to please, forget everybody, it's tough to please even 50%.
Well, I think one of the issues, and I just got reminded for about 31 days on the doorsteps of District 11, one of the most important issues on the minds of Islanders right now is healthcare. And as you know, I spent over 2 years in the portfolio. 4 years ago I started, and I had the opportunity to move some initiatives and was moved to education. But it was very, very interesting today. I had an opportunity to meet with the CEO of Health PEI and the board chair, Leo Stevens and Keith Dewar. And it was pretty exciting to see the progress and the movement that we've made.
You bring up Health PEI. Critics of Health PEI say the same things over and over. No transparency, no accountability. How fair is that criticism?
I think that in fairness to the conversation, I think that if you look at the, Health PEI is a relatively new organization. Basically, I am fully supportive of Health PEI. The whole discussion started a number of years back when we wanted to look at taking the politicians out of the decision-making process. I'm going to be very engaged with Health PEI. I'm very clear on my message to Health PEI that I am the minister and they will be accountable to myself as the minister. And I'm looking forward to looking at engaging Islanders in a very public conversation about healthcare and where we're currently at and where we need to go. So one of the things that we want to look at is we will want to look at ways that we can continue to build on transparency and openness. And as the minister, I see that as one of my immediate priorities.
One other big criticism is that a lot of people are confused as to what the absolute goal of Health PEI is. What is it in 10 to 15 seconds?
I think the goal of Health PEI is to oversee and to be accountable for the operational entity of healthcare services, but also to work very closely with myself as the minister to look at initiatives and investments and strategies to look at ways that we can continue to improve the system and to look at the whole question around sustainability.
If in 2 to 3 years when you leave this portfolio, if there is not a doctor for every Islander, will you be surprised and disappointed?
I think that physician recruitment moving forward is going to always be a challenge, and I think that we need to start thinking and talking about access to healthcare providers, to provide the service by the right professional at the right time when it's needed. And I think we have to start that conversation. I think that conversation is well underway. And, our priority as a government has been clear. Healthcare is the #1 priority.
Mr. Curry, I thank you for your time. I know your life has gotten busier, a lot busier in the last day. So thank you for making time for us tonight. We'll leave it right there.
It's a pleasure, Bruce. Thanks.
Coming up, a wild season.